Hey, good morning, everybody. Hi, Eric Vance.
Hi, Cindy.
Hi, Martha. Nice to see you.
Nice to see you too.
It's 11:30, and I'm just going to give it a few more minutes in case if folks are running a little late, just in case. Okay, it's 11:31, and well, just let me let this other one person in. Okay, good morning, everybody. Thanks so much for spending your Sunday with me. And I don't know what time zone you're on, but I'm on Pacific time zone. I live in Davis, California. So for those throughout the country, or whatever time zone you're on, I hope you're having a wonderful Sunday, had a nice relaxing morning, and I'm still sipping coffee. So that's a good sign. I wanted to, after yesterday's session, because I did this yesterday, I want to put a context to this presentation and what we're trying to accomplish, just to help folks wrap their head around it, because it's a little bit wonky, but it is really important in this way. And I'll go over this in a lot more detail. There is been the disintegration of retiree health benefits, employer provided health benefits, since about the beginning in the 70s and 80s. And this has to do with some accounting rules that we're going to talk about today. And what I want to try to do is to tie this messaging to organizing, particularly in the public sector, for Medicare for all, and really hopefully around people who are collective bargaining. But it doesn't have to be that way, because there are so many, I am a union member. I've been a union member for years, and there are so many people who are in senior organizations that this impacts, right? That are, having their retiree benefits either diminished or disintegrated, right? And it's because of this issue we're going to talk about today. So that's, as I start out on this, I wanted to provide a context for it. And let me introduce myself. My name is Cindy Young. I've been a healthcare organizer for about 50 years now. For a long time, and this has been my issue. I'm passionate about it. I can't seem to let it go at 67 years old in a few weeks. So I hope you'll enjoy this presentation today. I want to let you know the presentation materials were included, in a little link on the workshop when you signed up, but they're also going to be on the Labor Campaign, the Labor Campaign's website. Shortly after. We got everything branded with the help of Eric Vance, who's on this call today. So you'll be able to obtain these. And before you ever get to organizing on this issue, I want you to read that white paper first, because again, I think yesterday, if folks would have, before, I had a couple emails last night of folks who just wanted to jump in. And I think if you review the materials first before you start doing something, it'll help you better understand. So again, thanks so much for joining me today. And I'm going to share my screen. Let me bring up this presentation here. Okay. And I am gonna move this so I can see what the heck I'm doing. There we go. Well, all right, we'll do it this way. Okay, so can somebody just say that they can see my screen?
I see it fine, Cindy.
Great, thank you so much. I appreciate that. So again, my name is Cindy Young. I'm the vice chair of California Healthy Now, which is a state single payer coalition here in California. Our goal, our hope is that California, the Golden State, can lead the way for Medicare for all for the rest of the country, but certainly start breaking down some of those barriers here. Again, all the workshop materials are linked to the workshop piece that you signed up for, but if you didn't get them, if you don't have them yet, you can either get them off the website or you can go to Labor Campaign's website and they'll be available there for you. Probably, I'm thinking, Eric, correct me if I'm wrong, but by the end of next week, everything should be on the Labor Campaign's website. So
yeah, that sounds right. And I'm going to drop the link to the temp location now.
Oh, great. Thank you so much. You do that in the chat, Eric? Yeah.
Yes, it's in there now.
Okay, great. Thank you. Okay, so really, it's important to understand, as I had mentioned, this is really about the diminishment and disintegration of retiree health and welfare. And it's important to understand the background and the political context for what was happening, so we can help others if we're going to use this issue to organize, so that we can help others understand the history of who and why this happened, and the push for the pressure, right? The pressure points and the leverage points that exist that we can use that has led to this issue around employers, trying to take away that benefit from their workers. So, really, the beginning of this issue, and this is, again, this is the context going back, is, despite prosperity, major shifts were occurring in American business and the workforce during the 1960s. Pre-existing corporations were merging and becoming larger and bigger conglomerates, right? They were getting bigger, buying each other. Larger, often corporate-owned farms were being replacing family farms. This is when the big agribusiness started buying up, tiny family farms. Manufacturers were relocating from the Northeast to the Midwest to non-union states in the South and taking those jobs with them. And so also during this period, right, we had this new issue boom coming up. Complex business practices were taking place, corporate mergers, but there were no accounting practices in place about how corporations disclose their assets and their liabilities. And out of that then comes the birth of the Federal Accounting Standards Board, often people just call it FASB, right? FASBE, call it the FASB Board. And this was the birth of FASB, and it was to establish and improve accounting and reporting standards to provide useful information to investors and others, and other financial reports to educate stakeholders on how to understand the best practice and most effectively in accounting for corporations. So, capital markets didn't have reliable accounting standards. CPAs got appointed to the 7-member board, and when you research this like I do, surprise, surprise, all of these candidates came from Wall Street, right? People who had interest in, in the financial markets, and FASB's, purpose was to set up accounting standards for these corporations. And of course, immediately, the SEC, the Security Exchange Commission, recognized FASB, thought it was a great idea, right? And really pushed getting these accounting standards out. So also during this time, union density was at 30%, which was really high, right? We're down to, I think, less than 9% union density in our country now. But, those Amazon workers just got a contract. God love them. I'm so proud of them. They just got a contract. Maybe things going to change, right? And public sector was bubbling, but oftentimes governmental entities couldn't bargain. It was illegal for governmental employees to, at this point in time, to bargain. And unions were bargaining, right, as a part of bargaining for wages, hours, and working conditions. They were also bargaining lifetime, that the employer paid for lifetime health and welfare benefits for themselves, for sure, and oftentimes for their spouse, right? So if it was me, it would be my husband and I, and the employer was paying for that on a pay-as-you-go basis. So as someone retired, the employer would, pay for Cindy and Ron, right, on a pay-as-you-go basis. Well, also during this period of time, is when insurance rates, were increasing, even though a lot of insurers at that point in time were still not for profit. No one anticipated when they offered this benefits, I'm going to pay for your health insurance for the rest of your life, that benefit, right? No one anticipated that the corporatization of our health insurance system, and that, it would become a big business. No one knew this was coming. And a lot of insurers at that point in time, this just began the beginning of the insurers becoming not-for-profit to for-profit. So this was, the context that was happening, right as the Accounting Standards Board was establishing itself. So, so the financial institutions influence FASB. Well, of course, Wall Street investors said, we can't have anything that doesn't completely disclose all of your obligations, right? There are no accounting standards, and investors need to know your assets and liabilities. And Wall Street was demanding that that there be more accountability. So if I promised Cindy and Ron, that's my husband, I promised Cindy and Ron that I'm going to pay for their health insurance for the rest of their lives. And if I retired at 55 or 60, and my dad died at 79 and a half, so someone's going to be paying for me for a long time, I hope. You can see that that is a huge obligation that could exist for many, many years. And we don't have any cost controls on insurance. So that can be a big number depending on how many retirees you have, right? So this is the issue that's getting attention by Wall Street, as well as everything else, so that if someone was going to buy a corporation, they wanted to know that that company had that liability, right? That they had promised these benefits to those workers. And for those of you that have, been organizing or been involved in the labor movement for a while, there's a couple of Supreme Court cases that have not necessarily fallen in favor of retirees just being able to keep those benefits. So So FASB, let's see, I just got my notes here. So as the price of health insurance premiums increased and moral hazard economics were becoming popular, and I say moral hazard economics, and really what that means is that, you know, there was this philosophy that Milton Friedman, a very conservative economist, was promulgating, saying, you know, if you give somebody something for free, then they're just going to overuse it, right? That's what's going to happen. So this particular philosophy was becoming popular. So if you had free healthcare, of course, then you were going to go in and use it all up. I know the argument is ridiculous, but there are people that think like that, particularly people that have money interest. And the FASB board decided it was time that corporations list the liability and cost of providing those post-retirement medical benefits, often referred to as OPEB liability, and OPEB is other post-employment benefits. That's what OPEB stands for. It's a requirement called FASB Statement 106. That's when FASB issued Statement 106. That's when corporations were absolutely required to list this liability on their financial statement, so that an investor or a buyer would then know that that particular corporation had that liability. And so, you know, at that point in time, when you look at that number and would say, oh my gosh, you know, ABC Corporation has provided lifetime benefits for its workforce, and that's huge, right? I don't want to buy that company anymore because I'll have to pick that up if I buy it. It began to create strong financial incentives then for a corporation to reduce or eliminate benefits so that they could sell their assets. So during the process of how FASB got set up, you know, progressive and union leaders spoke out about what was required for these financial statements. There were reasonable voices that said, you know, use the CPI to project future costs, because an actuary has to project how much retiree health and welfare is going to be, you know, 20, 30 years away. And if you think about today, right, how much is health insurance going to be in 20 or 30 years? It looks pretty dismal, right? It's like, that's a scary number. So people were trying to say, use some measure, right? Use a CPI, consider cost containment mechanisms as actuaries were projecting this cost. But none of these suggestions were agreed to by the FASB board. They're like, nope, we're not going to have any of this. We're just going to let the actuaries project the cost without any cost control. And then another horrible decision came out of this. It was called the Rule on Anticipation of Change. This rule created miserable conditions for us that in collective bargaining, the employer was allowed to use this anticipation rule of change to reduce their liability if 4 conditions were met. So all they had to do was these 4 things to change their balance sheets, right, under this FASB 106. The employer could change the plan for retirees at any time. And as those of you that have been in collective bargaining know that retiree benefits are not a mandatory subject of bargaining. The employer could say, I intend to change the plan, right? It's my intention next year to, you know, take out prescription drug coverage for retirees. The employer has communicated it intends to change the plan. So I could even just say, you know, I'm putting you retiree on notice that I'm considering changing the plan, or that you have communicated the expected timing of changing the plan. And so the employer and the Wall Street community completely took advantage of this rule on anticipation and began saying things like, we're going to eliminate benefits, right? LTV Steel, that happened in the 80s, or we're going to create a defined contribution plan. So I'm only going to pay $500 a month per retiree and spouse or partner, and that's it. I'm going to limit my liability. And this rule of anticipation allowed them to do that. Well, it's no surprise to anybody on this Zoom that really what this was is a transfer of wealth, a huge transfer of wealth, because the CEOs were incentivized then to get rid of retiree benefits or limit the employer's responsibility for that. And then they were rewarded for that behavior. And this report that came out lays it out and connects the dots very clearly, that it has allowed CEOs to transfer the wealth from retirees to shareholders, and then the CEOs that did that got rewarded for for doing that. So soon after, of course, soon after, no one is ever happy in the private sector because they want to do the same thing in the public sector. So of course, not long after FASB issues these rules, Wall Street says, well, we've got to have these for governmental agencies. We need accounting standards for governmental agencies. And so the Governmental Accounting Standards Board, or GASB is often what it's referred to, was established in 1984 to develop financial accounting standards for governmental entities, because those didn't exist either. And so I want to tie this back to what I said earlier so that you can think about it, right? In the 60s, public sector organizing and collective bargaining was bubbling, and almost always in the public sector, they asked for and were actually able to gain the employer providing some type of post-retirement medical benefits to retirees. You see it often in contracts for retirees in the public sector. So GASB releases its preliminary report. Basic financial statements are released, but in 2008, GASB issued what's called GASB 45, which lays out how governmental agencies should account for their OPEB liability, or their post-retirement medical liability. And so GASB 45 changed how a state accounted for the future cost of other non-pension benefits, OPEB benefits. If retiree health and welfare obligation is long, it can impact state and local government bonds ratings. So if you have a school district that wants to get a bond to improve the construction or build new classrooms in its school, a bond agency is looking at their financial statements and saying, oh my gosh, your OPEB liability is a gazillion dollars. We're not gonna, we'll lend you money, but it's gonna be at a huge rate, right? So of course, what do school districts do, right? And also the GASB 45 said state and local governments must show the liability for retiree health and welfare for accrued and past and current retirees. So you would have to go back and calculate the liability of every single retiree that was still alive that you were paying for. So there was no requirement in GASB 45 to pre-fund this obligation that governmental employers had, but it was a huge push because of the future liability. So an employer is saying, I don't want that liability on my books. I'm going to pre-fund this ability. And of course, Wall Street said, that's a great idea. You can put all this money in the stock market or in our mutual funds, and then we'll hold that for you and to pay off your future liability. And that continues today. Pre-funding impacts for funding for current retirees. And again, this really created this downward pressure, because what happens then, again, when you look at the numbers of someone predicting the cost, and I want to just remind everybody that the most expensive population to treat for health insurance are people who are 55 to Medicare eligibility, because the chassis gets rusty. There's nurses that are on this Zoom, there's physicians that are on this Zoom, they can confirm that, things start falling apart. And so I'm one of them, have to see a physician or use the system more often. And bad things happen to us, right? As we get older, not bad things, but illnesses, right? Chronic conditions happen. And so we're expensive, right? We're expensive to treat. That's just how it is. And so the downward pressure then to eliminate benefits for new hire. So, an employer would say, anybody that's hired after July 1, 2020 is not going to get this benefit. But everyone, hired prior to that will continue to pay, right? So they created 2 tiers saying prospectively, we're not going to offer this benefit anymore. There were defined contribution plans established, again, just saying, I'm going to limit my liability. I'm only going to pay $500 a month instead of what it actually costs to insure you. So defined contribution plans. And I believe that this issue has led to Medicare, to the proliferation of a Medicare Advantage plans. And for those that are doing any single payer organizing and paying attention to the great job that PNHP is doing on disclosing the Medicare Advantage plans and how much more they cost and the denial of care. I think that this issue, because they can be less expensive at first, so an employer is thinking, well, I can get relief this way, right? I'm just going to offer Medicare Advantage plans. I think that this issue has led to more of those proliferation of those types of plans for retirees, because they're less expensive at first, but in reality, they cost a lot more than what it does for someone just to have Medicare. So for any employer that provides, care after Medicare eligibility, provides for health insurance after Medicare eligibility. So I just want to say, recently there were 2 new GASB statements that were released, and this is a little bit in the weeds, but if anybody's going to do any work on this, I just wanted to disclose this, right? Statement 74, and that should be statement 75. It's a typo in there. There's changes to the financial reporting framework, and here's what it does. It's not just for the cost of the current retirees, but future retirees. So now I have, as an employer, I have to say to the actuary that's going to calculate this for me, tell me how many future retirees I'm going to have to pay for, right? How many, if we look at the current turnover of my workforce, right? That's a number, it's an average. Then take that average and project out how many retirees I'm going to have to pay for, what benefits were earned during the current, and what's been promised, right? And promised benefits to prior and active retired employees. So this, again, just creates more, it's scary to look at those numbers and how much it costs. And I'm going to show you something in a minute that's going to make it look really scary. So it's a balancing act in the public sector and certainly in the private sector to try to balance the interest of the employers trying to get bonds to improve schools or trying to get loans to improve cities and counties, right? It's a balancing act versus, holy moly, people can't retire anymore, because I don't know if anybody has gone on the exchange recently and tried to buy insurance at age 60, but it's impossible. I mean, I don't know how you could retire and afford the premiums, and the benefits are skinny in those plans, and it's really expensive. I just did it as an experiment in California, Uncovered California, a couple of years ago, and I put in that I was age 60 and my zip code, and it's age banded, and for a not such great plan, it was $1,800 a month. So now, how could I pay for that at age 60, because I'm not yet eligible for Medicare, and retire? Right? So now this issue of employers not providing post-retirement medical benefits, at least until Medicare eligibility, is making people work longer than what they would otherwise, because they don't have access to health insurance. So here's just kind of the impact of FASB and GASB over the years. This slide comes from the Kaiser Family Foundation. They do what's called an employer snapshot. It comes out in the fall of every year. It's good stuff. It really does, it provides, probably 20 or 30 slides like this around the state of health insurance for employers in the United States. And they draw this from the Bureau of Labor Statistics. So it is union and non-union workers. That's the way it's looking at it. And you can see, I mean, I've got this 20-year snapshot, from 1988 to 2018. You can see the number of employees that have retiree health and welfare during this period of time has dropped significantly, from 66% to 18%. And it's because of this issue. And the reason that I know that is because I've worked in the public sector for over 40 years. And when you say GASB to one of those employers, you can see the little, hairs on their neck stand up. This is an issue that we really, I hope that we could move the employer to saying you could get rid of this liability that you have on your books if we had Medicare for all, because the cost of providing care to people who are 55 and older or whatever age that someone retires are wrapped into the cost of providing Medicare for all. And everyone knows that Medicare for all saves money in the long run, right? In the beginning, it costs us a little bit more, but as people get access to care, and those that don't have access to care get better because they do have access to care, there's lots of money that can be saved. So this is, I don't know how many of you know ALEC, but ALEC is the American Legislative Executive Council. They are probably some of the worst humans on earth. It's people like the Koch brothers. It's the American Legislative Exchange Council. Yes, it's the legislative arm of some of the worst corporations in the United States. People like the Koch brothers, right, really move this, and they set up targets. They're not nice people, but they're smart. And they set up targets for things, particularly things that they pay taxes for that they really don't like. Right? They believe in limited government, free markets, but mostly they believe in lining their pockets with cash. And if you are paying for retiree health and welfare via taxes, because that's what public sector is, right? These are, those benefits, roads, city services, school districts, state employees, right, who are administering our state governments, are all paid for by taxpayer dollars. So this report is from 2019. It is 2018, or it's from 2017. They have 2019 data in here, and you can see, right, that they've ranked these, right, in terms of the liability. Now, California is certainly the biggest state in the nation, but we have the biggest liability. So they've listed us as bad. We're number 50 on their list, and then it lists the liability for each state. But I'm going to give you a better resource before we end this session today. And then you can see that on this slide, I hate these guys so much. Those rich guys are really smart. This slide shows the average OPEB liability per resident, right? So they can pit us against each other, because what happens when I have something that's being paid for by taxpayers and my next door neighbor doesn't? What has the people like the ilk of the Koch brothers done to us? Oh, I don't have retiree health and welfare benefits. Why should I be paying for you? Right? And this slide really demonstrates that type of narrative. Is they use this to pit us against each other. So they even got it down to the per resident, cost. How much is it going to cost every single person in your state to pay for these exorbitant benefits for these, these older workers that have given their entire life to their employer? So, whoops, let me try and get into the next slide here. There we go. This slide shows us how much of the general fund our states are used to pay for retiree health and welfare. And it's all designed to scare state legislators, right? So if you take this into a state legislator and say, oh my God, look at California and your percent of unfunded liabilities, assemblyman or assemblywoman, whoever, right? You better take care of this. It puts pressure on state government then to act, right? That's what these slides are designed to do. So how do we stop how do we stop this downward pressure? Well, if we were all wrapped into a Medicare for all plan, either in our state or certainly in our nation, all of this cost would be wrapped into the cost of providing health care for everybody. So we create, like I said, I have this issue has been bugging me since about 2008. And as I've been working in school districts, during that period of time, I would just see it's a soft spot for everybody, right? Nobody wants to really talk about it. Everyone wants to try to hide it. The employer wants to try to get rid of it, right? And I thought, someday I got to do something with this, because Medicare for All would resolve that, would resolve this issue in the public sector and certainly in the private sector, but it's more prevalent in the public sector because we really do just run on taxpayer dollars and we're not for profit. So I decided I would create this toolkit. So one, I want to say the first thing that is on here that is not on this slide is we developed a white paper, a briefing paper, and anybody that wants to use this use this issue to organize for Medicare for All, I would encourage you to read that white paper first, because it's going to get you into a lot more detail than what I'm able to do in this slideshow, and also just help you better understand, right, the implications of this issue so that you can speak intelligently to folks you're trying to organize. We created talking points for governing boards at meetings. So if someone wanted to go to their city council, to their county board of supervisors, if they wanted to use this issue to educate their state legislators. In California, we have an assembly and a senate. Those are our two houses. So if we've had a tough time getting a vote, for example, on a bill like AB 1400, which was our single payer bill this last year, if we had a legislator we couldn't move, we could take this issue and present it to them to educate them about how this liability would go away if we had Medicare for All or a single payer system in California. There's FAQs on single payer, sample letters that you can use and sample speeches. And then I'm going to stop sharing my screen for 2 seconds, because what I want to do is pull this up, and now I'll share it again. Here we go. So thanks to the UC Berkeley Labor Center, they were able to get the OPEB liability for every single state in the nation. And they had an intern do this with the oversight of one of the employees there, who does a lot of healthcare modeling and finance. And you can see the link is there. You can see the page that it's on. You can see the total OPEB liability. The best we could do is get to 2019, but it's because there is not a standardized way that local and state governments had to report on this. I was trying to say, oh, I could create a template for all states and this is where they could find it, but that's just not possible because it's all done differently. So the Labor Center helped us develop this for the labor campaign at absolutely no charge to us to be able to do this. We've got some good folks fighting in there for us, and you can see that California's OPEB liability in 2019 is $91 billion. That's with a B, it's not an M. $91 billion. How powerful is that if activists were to take that into my assemblywoman who is not good on single payer and to say, Assemblywoman Cecilia, it's actually 94 billion is our liability today. I know that because I've tried to use this in organizing. This 91 or $94 billion liability would go away if we had single payer, right? If we had Medicare for all. Think about the job, how many teaching jobs could we have? How many roads could be repaired? How many bridges could be fixed, right? How many jobs, good jobs, right, could could we have with that money instead of spending it on insurance, right? For a small group of people, you know, retirees, basically people who are retired and get some form of retiree health and welfare once they retire. So this will also, Eric Vance is our one of our staff people on the labor campaign. Eric is going to put this on the labor campaign's website so that you could look at your state. And if you just want it, you say, well, I don't, you know, I live in, you know, I'm just going to use this as an example. You know, I live in Manhattan. I just want to use, I don't want to go to the whole state. I just want to get something from this for the city of New York, right? Or that's where I want to do my organizing. Remember that governmental budgets are public documents. So I would go, you know, these are state, you know, these are state numbers. And I want to tell you, I'm not an accountant. I'm not a CPA. I can add and subtract and multiply and divide. You know, I can calculate the cost of health and welfare because that's what I've done for years, but I'm not, you know, I'm not an OPEB specialist, right? So I would go to my respective city council person and I would say, you know, council person Don Saylor, who's a council person here in the city that I live in, I want you to tell me what the OPEB liability is for the city of Davis, right? I want you to give me the financial information that shows me that, so that if you wanted to pass a resolution in your city, right? And the ask could be anything. The ask could be, we want you to pass a resolution in support of the federal bill. We want you to pass a resolution in support of not disintegrating these benefits anymore. We want you to pass a resolution in support of AB 1400. We want to pass a resolution in support of the Healthy California Commission, which is Governor Newsom's commission that is supposed to help us get to a unified financing system in California. The ask can be anything, and you can tailor that to your needs, right? So I don't want you to think that this template is, you know, that it's this way. It's designed to be cut and pasted and used in any way that makes sense for you and your organizing. So we've just put these together to help provide a framework, and then you take it and cut and paste and do whatever it is that you you know, need to do to make it work for your set of circumstances. So let me pull that PowerPoint back up. All right. Can you, let me see, I'm gonna have to stop this again and then go to sharing again. Here we go. Okay. So that's what's in our toolkit. And I hope that you can take a look at those materials. I hope, you know, my biggest hope is that this is useful and it creates some opportunity to advance the cause that all of us believe in, or we wouldn't be spending our Sunday on this silly Zoom. So again, I went through how you found it in your states. And I would just say, you know, how do, you know, for me, you know, I was a staffer at California School Employees Association for a very long time, you know, over 20 years. And I did a lot of single payer organizing when in my role as the senior health policy advisor there. And what we did is we created a toolkit for classified school employees that had some of the documents that are going to be in this toolkit are very similar to what we developed before. I just updated everything. But our, you know, getting resolutions passed by a school board, and then it was for either Senate Bill 840, which was Senator Kuehl's bill, or Senate Bill 810, which was Senator Leno's bill, single payer bills, right? Our goal, it was not necessarily to get the school board to pass a resolution, although it was fabulous if it did, because it helped Senator Kuehl build support for single payer in the legislature. Our goal was to educate classified school employees, then take it over to the certificated side of the house, to the teachers, right? And educate them about why single payer, and then have those two unions take it to management and educate them about single payer. So getting a resolution passed or in support, to me, is a great goal, but the real objective of any type of organizing like this is to educate people about why single payer is the answer to the healthcare crisis in the United States, right? That's really what in my opinion, what our goal should be. So, what do I want to do with this toolkit? I'm going to meet with the machinists union who represent public employees next month, right? I'm working with SEIU 10-1. And I'm going to use this toolkit to go over with a committee that they have. Could I take this to the CLC, to central labor councils, and engage the public sector unions, right? And how Medicare for All would resolve this GASB problem for them, right? And then, like, who else could you think about that might be a good target? Your city could be strapped for cash, right? Is this a way that we could sit down with some council members and educate them, right, on why Medicare for All would be the solution to this problem? So I'm hoping that this data is useful and helpful. And then, what are the elements that you guys can use to use this in your stop share, there we go, to use this in your single payer organizing. So like I said, I think that what my observation is that this is it's a horrible problem for the employer and the union, and we could provide them with a vision, right, of how to get out of this mess that would one, take this off the bargaining table, because bargaining for benefits, as we all know, is a failed bargaining strategy. But it also, it's a hook for the employer, because it really is, this is not anything they like either, right, that they like. So with that, I'll open it up for questions and discussion. I'm just gonna peruse the participants list, and if you want to speak, raise your hand or just speak up, where it's totally casual. This is a conversation, so whatever you're most comfortable at, please ask your questions or offer suggestions that you have. I'm all ears with these little headphones on. Anybody? Any questions, ideas about how to use this?
Well, somebody already is asking in the chat, how do we get all this, these documents?
Yeah, so they're going to be posted, Greg, on the labor campaigns website, and Eric has also put the link in the chat, so you can get it right now, or you can look on the labor campaigns website, and they should be available. I said by the end of the week. I'm sure Eric will. Eric, when do you think is a fair target for you to get that work done?
It won't be me doing it. Mark might know better, but end of the week sounds doable. We've been
Mark,
in contact with the webmaster, so.
Oh, great. Mark, you've got your hand up too. So if you can answer both of those questions.
Let me commit to get it done by the end of the week. I can't, I'll try to turn it around faster, but we have to use a outside contractor to do the actual website work. So if you're really eager to get started, I would ask that you download the Google Doc that Eric has posted on the site here and get to work here. But I wanted to say, first of all, Cindy, thanks so much for this presentation. You've taken a really difficult and wonky issue and really, I think brought home what the potential for this in organizing. And I don't know if there's anyone in this meeting from the New York groups, but there's a huge fight going on right now in New York City, where city tried to move all of their retirees to a Medicare Advantage plan and would have then charged them money if they wanted to keep the traditional Medicare wraparound coverage. And the issue has been temporarily halted. A judge basically ruled that the city couldn't change the plan, but the unions are really backed into a corner in New York, because if this concession doesn't come through, they're going to have to sit down and bargain with the city on other cutbacks to save $600 million. So it's creating a real crisis. And interestingly, most of the unions in the Municipal Labor Committee, which agreed to this change, are also unions in New York that have opposed up to now the New York health bill, the single payer bill in New York, because they claimed that they could do a better job bargaining healthcare benefits for their members. So this is a huge opportunity in New York to change the political calculus by talking to these unions about how, taking these liabilities off the table and supporting a single payer reform in New York is the way forward for city workers. Not, it will make things better by taking this off the table. So we're really excited about using these materials in New York, because there's this group of really angry retirees in New York who are really, have begun to really organize around this, and this gives them some real important tools. And I would imagine there's similar things going on all over the country that we can think of to use this toolkit for. So thank you, Cindy.
Yeah, that's a great idea. The other thing I want to, share with you is that if for those, I serve on the board of directors of the California Alliance for Retired Americans here in California. And our executive director, her name is Jody Reed. I don't know how many of you know Jody, but she is a really good organizer and a delightful person. And she, there are so many retired folks amongst our membership, amongst the CARA membership, that are impacted by this, that they want to use this now as CARA as being able to, organize themselves and educate others. The minute you say Medicare for all, or you start fooling around with Medicare for a senior, you want to talk about the little hairs on your back standing up, but they all know that their benefits that they receive from their employer are a threat, and that it's not a guaranteed benefit. The law, there are enough cases that if an employer wanted to get rid of it, they could. And so this gives us, our CARA members, a chance to educate, right, our constituents on why Medicare for all, and then have them take that out and chat with others. So we plan on doing that within, the California Alliance for Retired Americans in this next year, and using this model, this toolkit, as a way to have retirees begin to start talking about this with their neighbors and friends. So, it's great for collective bargaining, but we can take it out to others who are at risk of losing their benefits and help them understand how Medicare for all would resolve that issue for them. Anybody else, any questions I can answer, or would like to make any comments or any ideas? Anne, I see your hand up. Ann Jones, you're on mute, Ann. There you go.
Yeah, thanks.
Whoops,
Minnesota here. Say, is there do we run the risk at all? Sorry, let me turn the news down. Do we run the risk at all of, let's say we were successful in getting some big companies to stand down and stop opposing Medicare for all? I mean, we need to educate beneficiaries about the insecurity of this whole house of cards, which is so interesting. I didn't have this much, I didn't have any inside track into this whole, let's say, set of arrangements and rules. But what if, let's say, we let employers know that, hey, this would be a good deal for you too. Why don't you get out of the way and let us organize for Medicare for all? And then we have a scenario where a Rick Scott comes along and conservatives win power back, and we learn that their game has been to eliminate federal programs, period, for decades. And I don't think people really understand that Republicans want to scrap Medicare, Medicaid, and Social Security. They have always disliked these programs. Do you see any, so let's say we disarm the corporate America and get them to get out of the way, and we are able to win a federal single payer Medicare for all, and then they take back power and literally scrap the entire benefit.
Yeah, I mean, I don't know, Ann. I mean, I don't know if that would
I
happen
mean,
or
I think we
not,
run the
but
risk anyway.
yeah, you do. And I think, I think that there are,
We are,
I mean, there are bad politicians and then there are bad people, but there are also, I mean, I work with some employers who are very decent human beings from school districts all throughout the state. They're not bad people and they want to do something about this. They are very gun shy about standing up about this, but I'm hoping that if we can just present the facts and take the, the sharp edge around, this isn't a tax increase. This takes this money out of your budget, right? You no longer have to list this on your budget and not hire or not fix a school, right? To be able to do that, I think we have some compelling arguments. And in Minnesota, I think about HCMC, right? Your public hospital system there. I did some bargaining there a few years ago, and
right.
the employers were, they weren't they weren't Penny Wheeler from Alina, right? They were not that. And if you could sit down and have a conversation with them, you might be able to help spin them and start thinking about this differently. And it may not even be a spin. It could be one conversation, and in another month or so, it's another conversation, right? Because this stuff is layered, right? What you put it out there, and people are like, all the questions that, usually come up is, do you want the government to take over your health insurance? And I'm going to lose my plan. And, all of that stuff, that those first knee-jerk reactions that the insurance companies has sent to us subliminally over the years. I think they send us, white noise at night telling us these things that scare the hell out of us. And once you are able to explain it to somebody, then it's like, that level, you've kind of, taken the water out of the boat and it's afloat again. And there's more openness about getting into a little bit of a deeper conversation. So that would be my approach, right? But your employers and in your communities better than I do, and how who you can talk to and begin to have a conversation with us about this. But it's terrific, I think, for representatives in the public sector who are having to deal with this. And when we did kind of a little bit of a briefing on this with our affiliates meeting for Healthy California Now, there were some public sector labor representatives, and they were like, oh my God, I hadn't even thought of this. Of course, this is the answer, right? So it's getting to the right people too.
Yeah.
Anybody else? Questions? All right. So everybody knows how to get the toolkit. You can get my email address from Healthcare Now. It's right on my profile on this workshop. If you have any, again, I want to remind you, I'm not a CPA, an accountant, or a bean counter. If you want to get numbers for city, for your city or your county or something like that, if you're the union, I would send out an RFI. I would send out a request for information asking for that. But if I were just a citizen wanting to organize, I would go straight to my representative on the County Board of Supervisors, or my representative in at the school district or on the city council, and say, I want to know what the GASB liability is for my city. And again, these are public documents, so you shouldn't have any problem getting them. So I want to thank everybody for giving me an hour or so of your Sunday, and my biggest wishes, I hope this helps us organize to victory. All right, everybody, have a great day. Thank you so much.
Thank you.
Thanks. Thanks, Cindy. That was great. I didn't understand this GASB for the longest time, and you explained it very well.